The flu vaccine is working better than expected, CDC finds. The flu vaccine is more effective than expected, federal health officials said on Thursday at a special news conference held to discuss the dangerous flu season, which is expected to kill more than 50,000 Americans. This year's vaccine is about 25% effective against the H3N2 strain of flu that is causing most illnesses and deaths, said Dr. Anne Schuchat, acting director of the Centers for Disease Control and Prevention. In a bigger surprise, the vaccine is about 51% effective in children, according to the CDC's preliminary analysis. In Australia, the same vaccine was rated about 10% effective overall against H3N2, and a recent Canadian analysis found it to be about 17% effective there. Dr. Schuchat and Alex Azar-Too, the new Secretary of Health and Human Services who led the news conference, also pointed to a CDC study published Monday in the journal Pediatrics showing that two-thirds of the 675 children and teenagers who died of flu between 2010 and 2016 had not gotten the vaccine the year they died. "Go get a flu shot," Mr. Azar said loudly as he ended his portion of the news conference. "Do it for yourself, your family and your community." He, his wife and his children had all had flu shots, he said, and so had President Trump. "The vaccine is 36% effective overall," Mr. Azar said, and 59% effective in children. He compared the vaccine to seat belts. "Imagine if we could cut our chances of being in a car crash by 36%, or our child's by 59%, he said. The comparison was only partly correct but very apartment. The figures refer to the effectiveness of the vaccine against all circulating strains, including H1N1 and B strains, which have only barely begun to appear this year. But seatbelts are a telling analogy for flu shots. Studies done since the 1970s have shown them to be only about 40% protective against preventing any injury in a crash. But they are highly protective against death, that is, when crashes are so severe that some occupants are killed while others live, it is almost always the ones not wearing belts who die. Likewise, studies like the CDC's suggest that flu shots do a better job of preventing death than preventing sniffles and aches. The event ended with a large panel of experts awaiting questions. Only one was asked whether administration officials wished they had done anything differently about flu this year. Dr. Schuchat replied by describing problems that vaccine makers face. She did not address a bigger issue of concern to the CDC. Only about 40% of Americans get flu shots each year by the time the season begins in November, and that number has been going down, not up. The Trump administration and its top health officials have been criticized for showing little public leadership as the flu season became more dangerous. The news conference appeared to be an attempt to remedy that.